Now the gel that we're using, and we'll talk about a little bit later, is considered to be phonophoresis because it isn't just plain ultrasound gel. It actually has a topical analgesic in it, so that's called phonophoresis, the administration of medicine via ultrasound waves. So then it's going to go to our patient over here. Our volunteer patient has been complaining of back pain. Trina, how long have you had the back pain for?
1 year.
So she's had it for a long time, so it's not an acute injury, it's chronic. So therefore, we're going to do the continuous just because she's had it for a long time, and we're going to do the deep because it's back tissue and there's lots of layers of back muscles, so we want to do deep. As you see, as the ultrasound is turned on, he's gradually applying it to those back muscles, to the back area. He's not going to do it directly over her spine because we don't want to do ultrasound ever directly on the central nervous system, and we'll talk about a couple of other indications of why we would do one or the other. But he's just going to keep the wand moving this entire time, not to hold it too long at any one spot because that could actually burn the patient. So move it just a little faster. You also want to keep the ultrasound within a 5 centimeter square area because if it's a really large area, it's not going to be effective. Now, in this case, we're doing the continuous ultrasound because that shows thermal effect. She may have muscle spasm in that area, joint stiffness. She might have some pain, which she's describing, and she's got a long history of being a gymnast, so she probably's got some chronic inflammation and tightness in that area. So therefore, we're doing the continuous ultrasound. So more about continuous ultrasound as he continues. Other reasons we may use the continuous ultrasound is to increase the extensibility of soft tissue, decrease the pain, as she's mentioned, she has pain, increase the metabolic rate, and increases blood flow to the area. It also helps stimulate the immune system. Another reason we can use this is prior to stretching. It actually heats up the tissue, so it's good to use before she's going to do some stretches for the capsule or ligament. Helps with the pain and helps with chronic inflammation conditions.